I'd like to call to order the Human Service Commission regular meeting of Thursday, August 26th. It's now 9:36 a.m. I see that all members of the commission are present. Hello to everyone. And we'll move on to item 2, which is the adoption of the agenda. Can I have a motion to approve the adoption of the agenda?
So moved.
All in favor?
Aye.
So moved. Item 3, adoption of the June 24th, 2021 regular meeting minutes. Can I have a motion for approval?
So moved.
Second.
All in favor?
Aye.
Aye.
So moved. Moving on to item 4, Trent Rohr, our Executive Director's report.
Good morning, President Khan and commissioners.
Mr. Rohr, good morning.
Commissioner McCray, good to see you all virtually at least.
Yeah. See.
I'm sorry?
I say I could be seen.
There you are.
Yeah.
Well, half your face at least.
Yeah.
All right, well, let's get started. I'll start at the federal level. Just one item I want to bring to your attention. We don't have a ton of detail yet, but the House on Tuesday approved a $3.5 trillion budget blueprint, sort of the initial step. But included in it is a really vast expansion of the social safety net. Dems were sort of had internal rifts to advance a critical piece of the domestic agenda, but in it is things like universal preschool, paid family leave, federal support for elder care and child care, expansion of Medicare. So it's sort of an initial step, but significant in that it got through, of course, no Republican votes, but it did get sort of bridging some moderate Dems, progressive Dems to get the first step towards a pretty ambitious domestic agenda of addressing a lot of the households that we serve and some of the programs that we run. So I'll keep you posted as that progresses through. It's got a long way to go. So not a lot at the state level. The budget passed and some pieces of legislation are sort of winding through the process, but no big issues there. I mean, the really big work with the state is them beginning to operationalize a lot of the expansions to benefits that the legislature and the governor passed in the budget. And I'm going to talk about that when I get to the program portion of my report. So shift gears to our COVID response and sort of where are we at as an agency and a city in terms of COVID. Our work with the hotels has really shifted very significantly in that we're no longer operating them, and we're no longer charged with transitioning homeless individuals from their SIP hotels to permanent housing. Although we do have some HSA employees deployed as disaster service workers helping with that work, the city's Department of Homelessness and Supportive Housing is the lead on it. However, we do have a role. Our role is to work with HSH to demobilize the hotels once they are emptied. They have, I believe now they're at 4 hotels that we are working with them to demobilize, meaning we have to contract with cleaning crews and sort of some of them need some significant rehab, paint, things like that in order to return them to their initial condition and back to the owners. And so sort of we're working hand in hand with HSH as they move staff out. I think what's just sort of one piece that you may have seen, FEMA has extended the 100% reimbursement for these hotels through December 31st. And so basically what that allows the Department of Homelessness and Supportive Housing to do is extend the time period under which they have to move residents into permanent housing. It's proven to be a pretty difficult task and it's slow. And so the additional months of reimbursement will help the runway on the back end without exposing the city's general fund to significant unbudgeted costs. The biggest focus for HSA right now is on our, well, threefold. One on food support, but the other two areas are on partnering with the Department of Public Health to maximize the number of San Franciscans who are vaccinated. And we're also focusing internally on reopening HSA into sort of our new normal working environment where we have individuals on staff or on site and also telecommuting. So let me start with the vaccinations. So we're partnering with DPH to organize periodic vaccination mobile clinics at our service centers. So at 1235 Mission, 170 Otis, and 1650 Mission Street. We've been doing this since early June. The uptake hasn't been huge. We've done about 60 vaccinations so far. And so to sort of increase uptake among households who are served by HSA, we've, with DPH, identified households who may have a member who does not have a vaccination record in a DPH database. And so what we have done is sort of a pretty massive communication effort, including texting, emails, postcards. So we sent out texts to over 8,500 unvaccinated individuals on Friday, August 7th. And these are individuals who gave HSA permission to text them in advance when they apply for their programs. We sent the texts in their threshold, their languages. So whatever language that they had indicated in their application they speak. So English, Chinese, or Cantonese, Spanish, Tagalog, Vietnamese, and Russian. We also sent out emails to over 21,000 individuals in early August. These went to clients who are served by the Economic Support Self-Sufficiency Division in one of our programs, who did not have a vaccination record. We will be sending out emails to 145 community-based organizations to update them about the different ways, different vaccination opportunities, the clinics and others that they could share with their families and clients they serve. And then we'll be mailing over 22,000 postcards to households by the end of the week, including IHSS recipients and providers, and additionally clients who are served in our economic support programs. Again, all those postcards will be in the appropriate languages as indicated by the clients. So it's really I think I said at probably a year and a half ago now, or a year ago, that working on the COVID response, the initial COVID response so closely with the Department of Public Health has really, I think, helped us forge such a really good partnership with them in a whole lot of areas. And this is, we have so many clients in common that it can only benefit residents of San Francisco. And this is just a good example where DPH partnered with us to identify individuals in our programs who aren't vaccinated yet, with the interest of getting as many people vaccinated as possible. DPH also has a vaccine hotline that people can call to sort of get questions answered and to help address concerns that they may have. And then lastly, we're finalizing an all HSA client. We're calling it a summer assistance program letter, which basically towards the end of the summer, anyone who touches HSA services will receive a letter in their languages that includes information about vaccination sites, rental assistance, new rental assistance that the state and local and the city is providing, legal assistance related to tenant issues, information about jobs now, and information about the child tax credit. So that will be going out soon as well. So the other area that we're focusing on really is HSA operations and sort of the reopening, and when are we going to have more staff on site to provide assistance to clients who come to one or many of our buildings. So we had initially, in accordance with sort of the mayor's plan and the plan for the city administrator, had targeted early September. Some departments were going to be September 6th, some September 13th. We were going to do September 13th. But those plans were done or sort of thought through in spring, in sort of April and May. And clearly we've had the Delta variant rear itself, resulting in a much higher infection rate, even among vaccinated people. Though vaccinated people aren't getting very sick, nevertheless, they're getting infected. And then those who aren't vaccinated, of course, you're seeing every day reports on the news about the increased number of people who are being hospitalized. And so given that, really city leadership, including myself and the director of health, recommended that we push back the city reopening date to November 1st. And the reason we chose November 1st is because it represents the 10-week period after which the FDA approved the Pfizer vaccine approved it on a non-emergency basis, basically, which triggers all city and county of San Francisco employees it triggers the requirement that they get vaccinated by November 1st, which is 10 weeks post approval. And so we determined that that's sort of the way to maximize safety for our employees and our clients, is that we're assured that by November 1st, anyone who's on site will have been vaccinated because it's the city directive from DHR, and that we can operate with masking and the vaccination in a safe manner, or as safe as possible. And so communicating sort of this fluid environment constantly under COVID to our 2,400 employees is challenging. And so we're really working on a multi-pronged communication strategy with our employees to engage them sort of ahead of the return to office. So to that end, Kelly Dearman and I, Kelly, the director of the Department of Disability and Aging Services, and myself will be hosting an all-staff town hall today at 2 p.m. to address staff questions that were submitted in advance and their concerns about returning to the office. This is where we'll share that we're pushing back from mid-September to November. We had already sent out an all-staff communication, but it's good to keep repeating this. In addition, we're going to be doing an email update to employees regularly regarding the reopening. We're producing a video with our human resources outlining what staff can expect upon returning. And then we're doing employee welcome kits as well, which will be distributed to every employee coming back. The guidance from the city, from the mayor's office, from the city's Department of Human Resources is that city staff across all departments will be working a minimum of 40% on site, or working in the field a minimum of 40%. So 2 days out of 5. It may not be 2 days out of 5 for everyone. It might be, week on, week off sort of thing, but it's basically 40%. And so working with all of our programs to assess kind of how we do that operationally while maintaining services to clients. The tricky part for us is really trying to assess the number of clients or prospective clients that are going to be coming on site. It's very difficult to, right now we're operating in an environment where we're doing everything remotely. Clients have seemed to have been gotten used to transacting business on the phone or online. And so we may not see a whole lot of folks returning to our lobbies. And so we could manage our work, with a 2 out of 5 workday on site. However, we may see a big increase. We may, once unemployment insurance benefits expire at the beginning or middle of September, we might see more people on site. In 2022, when a lot of the eligibility requirements that had been suspended by the state resume, we might see more people on site. So we're going into these operational plans knowing that they need to be fluid, and we're going to need to adjust, which may require us bringing more staff on site, but that remains to be seen. And it's really going to be driven by client need. I mean, we have to, keep in mind that while keeping our employees safe is paramount, serving clients and being able to provide them the benefits to which they're entitled is the most important thing. And so we'll be keeping an eye on that. In terms of vaccinations, all staff have been required to report on their status. Earlier this month, we have 98% of our staff have already reported, which is great. About 80% of them reported that they've been vaccinated. And so we really need to get that last 20% over the hump. And we'll be working again with Department of Public Health and a lot of strategies to do that. In terms of our operations and reopening, it's really the biggest lift right now is on our IT and our facility staff. IT is doing a lot of work preparing our client lobbies and interview booths with new computers. Most HSA staff now have a laptop that replaces their desktop. So we have to sort of fit the cubicles and offices with external monitors and docking stations. I mean, we're talking thousands of employees. And so it's a huge lift from IT. And so just a shout out to Natalie Toledo, our IT director, and the staff who've been working so hard on site to equip our buildings to be able to handle our return to work in the beginning of November. So shifting gears a bit into our programs, really there's been a significant amount of investment into our agency to serve individuals, families who were affected by COVID. Affected either because of illness or because of economic hardship due to job loss or reduction in working hours. And so we've done a number of things. I just want to walk through them because it really is quite an impressive array of initiatives that we're rolling out. The first is around Jobs Now. We've really strengthened, with the investment of the mayor and the board of supervisors, strengthened the Jobs Now program to increase engagement of job seekers, but also small businesses as they get back, reopening and back on their feet. We've adjusted our wage subsidy tiers to help employers retain their employees. We're reimbursing 100% of wages for the first 3 months. We're including as an eligible population job seekers whose income is under 300% of poverty, which is almost 2.5 times the sort of standard income threshold of clients that we serve. So we're really serving a broader array of individuals who aren't eligible for our other programs, but they are eligible for job assistance through our local decision. This has just started. In the first 7 weeks of this, we've placed 96 individuals in jobs, but as again, with Delta variant, things are slowing, but as we pick up, we're really positioning ourselves to serve hundreds of people with a goal towards upwards of 3,000 people placed in jobs throughout the fiscal year. We're also co-locating with the state's Employment Development Department, EDD, their office at 801 Turk. So we'll have staff on site at 801 Turk to really help bridge as individuals lose their unemployment or their expanded unemployment benefits in September, help bridge them into the services that we can offer, including job opportunities through Jobs Now. We have $1 million in funding for our Digital Divide initiative, which is basically funding to equip 1,000 of our clients with laptops paired with digital literacy training and connectivity and tech support. We're in a virtual world now, and asking individuals to find a job without having technology to do so. Interviews now it's very common to have them on Zoom or another virtual platform, and so we want to make sure that our clients can access that and aren't shut out. So far, again, another new initiative. We've done 88 clients so far, but we have a budget for 1,000. We've provided assistance to our undocumented residents who are on CalWORKs. And so typically this would look like children who are born in the United States, and so who are citizens, but the parents are undocumented. These households are still eligible for some CalWORKs benefits. The parents were not, however, eligible for the federal stimulus funds because of their status. And so what we've done is through CalWORKs, provided these households with a one-time $2,500 benefit, really sort of filling the gap from the federal stimulus that they did not receive. It's also a way for us to sort of provide some light case management and get these households to understand what we can offer them, even though their status is one that's undocumented. We've also begun an engagement incentive for CalWORKs welfare to work participants to participate in activities. We can allow them to earn up to $500 in incentive payments if they participate in activities for 10 weeks. Things like job readiness training or English as a second language work. And so far, again, it's new. 49 participants have received incentives so far. And then lastly, what we do every year, we continue to do is the Working Families Credit, which is helping households apply for the Earned Income Tax Credit, as well as the local Working Families Credit, which under Mayor Breed's expansion is now, you can receive it more than once. It used to be $250 on a one-time basis, and now households can receive that again. And we've also included an additional $250 for these households, so that we're going to be receiving $500 instead of $250. And then lastly, again, another partnership with the Department of Public Health. We used money. I think I talked about this in the spring. We had a large budget for Jobs Now that we had launched in November of 2020, and that was undone by, I think maybe it was the third surge by then, whatever number it was. But in November or late November, December, the city had to return to a shelter in place. So the Jobs Now funding was not going to be spent. And so the mayor agreed with a proposal that was developed through our program staff to shift that money to provide relief for undocumented households. And so what we did is we came up with a program to provide $550 Visa gift cards to over 5,400 undocumented low-income San Franciscans. And I said it was a partnership with public health. We identified them through the Healthy SF program. Healthy SF was developed prior to the expansion under the Affordable Care Act, the expansion of Medi-Cal. So the population that's mostly served through the city's local health access program, Healthy SF, are undocumented households who are not eligible for the Medicaid expansion. And so we were able to identify 5,400 low-income San Franciscans who are on Healthy SF, don't qualify for Medi-Cal. And so we are mailing out these $550 Visa gift cards to that population. It's about $3 million worth of investment. And really want to thank the San Francisco Health Plan, that's who administers Healthy SF, because they're donating all the labor and all the mailing costs associated with the project. They did the work of identifying clients on their dime, and again, doing all the mailing. And again, this demonstrates, a really good partnership across departments and even now the health plan. So I mentioned at the beginning of my report changes at the state level that's expanding our programs, either a benefit amount or access in two areas, principally Medi-Cal and CalFresh. So in Medi-Cal, there are three significant expansions. The first one is, and this is through the state legislature, the first one is Medi-Cal expansion for undocumented individuals over the age of 50. I think prior it was over the age of 60. And this is Assembly Bill 133. It's full scope Medi-Cal to individuals aged 50 years of age and older who don't have a satisfactory immigration status to qualify for the federal program. So we're calling this the Older Adult Expansion, and it'll be implemented beginning May 1st, 2022. And so we're prepping for that. We're sort of analyzing what's the population in San Francisco and sort of what is the impact on our operations. So we have time. The legislation called for May of 22. The second one's a really big one. It's somewhat arcane, but it's significant. And what it is, it's the elimination of the asset test. What is the asset test? The asset test said that individuals, and usually it's seniors or individuals with disabilities, if they're otherwise eligible for Medi-Cal, they can't have assets that exceed $2,000 for one person or $3,000 for two, which basically means that if they have a savings account or something like that, we would require, the state would require them to spend all of that money down until they only have $2,000 left, and then they'd be eligible for Medi-Cal. Well, clearly I don't have to explain why that's for lack of a better term, a stupid rule. And so what Assembly Bill 470 did is they increased the asset limit effective July of 22 to $130,000 for a single individual and $65,000 for a household member. So no longer do individuals or a couple have to become destitute in order to access health insurance that they're entitled to receive. And so that's a really big deal. And then we're working towards a complete elimination of the asset test contingent on federal approval, hopefully by 2024. And this is something we have fought for 2 decades, literally. And to finally get it done is really a big lift. And thanks to really great advocacy by our partners in the senior community and disabled community to get this done. And then lastly is a Medi-Cal expansion or extension for postpartum individuals. And so basically you get Medi-Cal coverage prior to this for only 60 days postpartum, and this would extend it up to 12 months. And so pregnant women who are eligible under Medi-Cal would retain the coverage through this extended period, which is also a great benefit. And now in CalFresh, you may have seen, this did get some coverage in the press, that the federal SNAP, which is the Supplemental Nutrition Assistance Program, in California it's called CalFresh, but the federal SNAP allotment or amount was increased for the first time in decades. The allotments for CalFresh, well, again, nationwide SNAP, but in California, CalFresh was increased by over 20% compared to last year's figures, which basically means that everyone who's receiving CalFresh is going to receive 20% more in food purchasing dollars on their EBT cards. So an example of household of one would see a monthly benefit increase from $204 to $250. And this will go into effect, I believe in October. Yeah, October 21, for all of our CalFresh recipients, which in San Francisco was over 55,000 people. And then lastly, in CalFresh is the pandemic EBT, which is basically it's identifies households who are receiving free or reduced lunch and provides them with additional dollars through an EBT card that allows them to purchase groceries. So basically up to $492 in benefits from October to January for children under 6, and then $738 in benefits for school-aged children from August to January. And then that would roll again for the rest of the school year. Basically what it's covering is the entire 2021 school year. And so these households will receive those additional funds up through the end of June of next year. So then last in the division of Family and Children's Services, Commissioner Semmel, you asked in our last meeting about our foster family recruitment, our resource family recruitment, whether or not we're seeing an increase based on our marketing and based on the efforts we're doing. And so I didn't know what our numbers were at the time, but my staff did a report for me, and I'm happy to say that we saw a 244% increase in the number of inquiries. So we had 134 people saying, hey, I might be interested. Last year, we had 327 people contact us to say they're interested this year. So then that rolled sort of the next, which is how many applications did we get? Well, we got about a 70% increase from last year, an increase from 53 applications to 90. And then we saw a 4-fold increase of the actual approvals, which only amounted to 22 additional homes. Our goal is 100, but 22 additional onboarding under a pandemic is actually very impressive. We only had 6 last year pre-pandemic. We have had 22 here. And the reason I think that's impressive is because a lot of families don't want to take on children under the pandemic. Even our existing foster families are hesitant to take on new children for fear of exposure and infection. And in addition, when you're a new resource family, you are interacting a lot with our social workers. And so I think there is some hesitancy there. So getting 22 on board, I'm very pleased with. I think we're going to see a lot more in this next fiscal year. And then related to that, the state is really, or we're really working hard to reduce the number of times it takes to approve a resource family. The state mandates a 90-day approval deadline. In 2019, we were at about 153 days. So we've moved now to a median of 96 days. So we're almost completely in line with the state. And again, doing that in a remote manner is very, in my mind, it's impressive work. And then lastly, I've talked a lot about gift cards and one-time payments to people. I don't want to forget our foster youth. California received federal funding to send a one-time direct stimulus cash payment in the form of a debit card to our current foster youth aged 18 to 20. They need to fill out an application that we can assist them with by September 3rd. And we've been working with our supportive transition units, which is our units that work with our teens, has been working with Robin Love's team to ensure that our youth who meet the criteria do apply. And so they get their, it's called the Chafee card. They get their Chafee card. About 80% of our youth have been contacted. So we're getting the word out. And the state has a role as well. They have to certify eligibility. So our youth apply through this portal that then actually goes to the state. The state works with the vendor to send the EBT card or the debit card directly to the youth. So our work really is identifying them and getting them to apply. So with that, I'll pause and open it up to questions. I know it was long, but we didn't meet in July and I had a lot to share. So any questions or comments, commissioners?
Any comments from members of the commission?
I think Commissioner Semmel. Go ahead, Commissioner.
I'm very impressed with what you're doing, and I think it's wonderful. And we're very lucky to have you. And to all that you and your staff are doing. Appreciate it.
Thanks, Commissioner. Appreciate it.
Any other comments or questions? If not, then we're moving on to item 5 on the agenda, which is the presentation of the August 2021 Employee of the Month, who is Deanna Maxey. And Deanna's online with us. Hi, Deanna.
Good morning.
Good morning. The commission is pleased to announce that Deanna Maxey, SFBN Supervisor, is the August 2021 Employee of the Month. Deanna manages the SFBN outreach team that provides application assistance to the homeless persons living in the shelter-in-place hotels, congregant sites, and safe sleep encampments. Since September 2020, Deanna's team of 3 to 4 eligibility workers has been knocking on hotel room doors while standing in entranceways, guiding clients throughout the application process. Deanna and her team submit My BCW applications on the client's behalf, which often includes uploading photographs of important and necessary client documents. Deanna was meant for this job. She is passionate about the clients she and her team serve and thoughtful about the challenges that they face. Building trust and respect with the community-based organizations that manage the sites has been one ingredient in Deanna's recipe for success. Another ingredient is careful attention to tracking and data. Deanna is eager to continually improve the outreach model and enjoys learning on the go. She is extremely proud of her staff and went out of her way to celebrate their 100 applications with balloons and cake, with interactive celebrations thereafter. While lots of the world is safely at home, Deanna, her team are working throughout the pandemic on site at the hotels and encampments, helping people without homes. Congratulations, Deanna, and thank you for your significant contributions to the HSA.
Thank you, Commissioner.
Calling on Trent now for a moment.
I just want to share, Deanna, congratulations. And, I know full well the challenges that are in the SIP hotels. We're taking this opportunity. I think, we've done so much work in housing homeless individuals, protecting them from COVID, to go the extra step to not only trying to house them permanently after they leave the hotels, but to get them on benefits while they're there. It's critical. It opens the doors to food support. You can use your EBT in restaurants, as you know, right? Getting on Medicaid, Medi-Cal. And I just want to thank you for going above and beyond, and for, frankly, doing work that maybe a lot of staff found risky or, and challenging, and certainly above and beyond the regular eligibility work. So I just want to thank you so much for leading the group, and please share my thanks to them if they're not on, for their great work. And it's really, the SIP hotels system is such a model for the state and the country, and this is just another reason why, and so I just want to say thank you, and I hope you're proud of what you accomplished and what you continue to do, because I am. I know that clients thank us for what we're doing.
Thank you.
Very welcome.
So Deanna, now's your time to have some words if you'd like them. And could you let me know, is your mom online with us?
I don't think so. I was trying to get over to the office, and our traffic for today in the city. So I had to go in the midpoint. But
Okay. Well, go ahead. Any comments you have that we'd all like to hear, actually.
Okay, well, thank you. I definitely want to thank you all for this honor. It's such a blessing, and it's just so exciting to do this work. I saw some of my team members and my manager waving in the background there, so that was cool. I really want to say that, this opportunity has been a great one. When the pandemic hit, this was, well, not in the beginning, but during the pandemic, this was just an idea for us to go out and think about how we can serve this population, because they're so hard to reach, especially the homeless individuals that don't have addresses. And, I just think back to the launch when we first went out, and, my team, they were ready to go. And this was really, I believe, just such a great collaboration between so many different departments and our community-based organizations. And I think that's why it was such it just was really a phenomenal push to get this done. And we share the numbers, like we did so many applications and this much CalFresh and Medi-Cal, but for me, it's truly, we were able to touch that many lives and to help them have a better existence, whether it's Medi-Cal, food stability, and just also on a road to self-sufficiency, and to be able to hopefully get housing. So this is, I'm getting choked up. This is, it's an honor to be able to do this. I'm just really happy that I was able to help put this together. And I hope that we continue going out and taking our office out to the people that need it the most. Thank you.
Yay. Thank you once again. And it's nice seeing you online. And hello to your family. I wanted to say hello to your mom, so in particular, but just tell her I said hello. Anyway,
I will.
congratulations.
I will. Thank you so much.
Congratulations.
Thank you, Trent.
You bet. Thank you.
Moving on to item 6, the consent calendar. And do any of my fellow commissioners want to remove an item for individual discussion? If not, then I ask for a motion to approve this.
So move. Second.
All in favor? Aye.
Aye.
So moved. Moving on to item 7 on our agenda, commission business action items, calling on Justin Chan. And item A here is annual hearing regarding the homelessness and supportive housing fund to provide an analysis of the FY 20 to 21 savings and to review estimates on the 21 to 22 years pursuant to an administrative code 1100-77. Is there any comment? And we have Justin online with us. Hi, Justin. Good morning.
Unmute yourself, Justin.
Oh, Justin, you can start over.
So sorry. Yes.
Start
yes.
over.
So sorry about that. Good morning, Commissioners and Director Rohr. I'm Justin Chan, Principal Budget Analyst for the Human Services Agency. The Homelessness and Supportive Housing Fund, formerly the Human Services Care Fund, pays for housing and services for homeless CAP clients through the savings resulting from the implementation of Care Not Cash. The ordinance requires that on an annual basis, the Human Services Agency report whether its projected savings were accurate for the year. Before I review the projections, I want to explain the Human Service Agency's continued relationship with the fund and its partnership with the Department of Homelessness and Supportive Housing, or DHSH for short. The savings from Care Not Cash that support this fund result from two sources. One is the reduction in the homeless CAP caseload, and the other is reduced grant amounts for homeless CAP recipients who are offered shelter. Since HSA continues to administer CAP, we will continue to handle the calculations of these savings annually. We transfer these savings at the end of each fiscal year into the Homelessness and Supportive Housing Fund. DHSH then uses these funds to administer their housing and services for their clients. So the savings for fiscal year 2021 came to $16.8 million, which was around 1.4 million less than budgeted and about 860,000 less than our final full year projection, which was made in July of 2020. For fiscal year 21-22, the official care fund budget is set at 18.2 million. The homeless cap caseload and city's shelter bed capacity were affected during 2021 and will continue to be affected in 21-22 by COVID and the social distancing requirements. But shelter bed capacity across the city is in the process of being restored. Starting in October of 2021, the CAP aid grant will increase by 5.3%, which will increase the maximum pool of possible savings that this fund could generate. These factors will affect the fund balance throughout the year, and I wish to make clear that all dollars which don't go towards this fund are paid to homeless CAP clients in the form of cash aid. HSA staff recommends that the Commission adopt the findings regarding the fiscal year 2021 homelessness and supportive housing savings and transmit them to the Board of Supervisors and the Office of the Controller. And I am happy to answer any questions. Thank you.
Good morning. This is James McCrae. Looking at the bottom of the memorandum, page 1, you indicated that there will be an effect on savings or non-savings by the COVID pandemic continuing, and then economic recession. How deeply have you all projected that recession might be, and how does it impact our savings or non-savings?
I think for this fund, so the two main sources are the degree to which we can lower the homeless cap caseload, and then also how often we can offer shelter instead of cash aid. And so I think the shelter capacity is a very major factor, I'd say, in driving how much savings we get. If for the duration that there are not that many beds available and we cannot offer these clients a place to sleep for the night, we will give them the full aid amount. And then of course for the with the recession impacting employment opportunities, we have made a lot of investment into our workforce services programs and trying to make every avenue possible to find people and pair individuals with work opportunities or job training. So we have lots of investments in that budget area. And as far as the fund, it really depends on our ability to provide shelter and also get people off of aid, which of course one avenue, a big avenue is through housing, but also eventually their own employment.
Justin, if I can, Commissioner McCrae, it's Trent. So under the pandemic, we had to, or the Department of Homelessness and Supportive Housing closed the shelters, closed new access to shelter, right? And also for existing shelters, significantly reduced the population so we could do the 6 feet of separation. One of the keys to being able to implement Care Not Cash is to be able to offer a shelter bed as an entitlement to applicants for CAP who are homeless. Because we couldn't offer that shelter bed, they're legally entitled to receive the full cash grant. And so since we began Care Not Cash in 2004, we have never had to cash anyone out. Everyone was guaranteed a shelter bed because we had capacity in the system. Because of the pandemic, we didn't. And so as a result, we're going to see a lot less savings to funnel towards housing because we're giving away, because we're providing full cash grants. And so as we work, as the CAP team works with HSH when we repopulate the shelters, which we've had to pause because of Delta, we'll sort of slowly be able to get back to that stage where everyone gets a shelter bed and gets off the street while they're waiting for housing, and that drives the revenue. So that's kind of the biggest piece.
Thank you.
You bet.
Thank you, Mr. Chen and Mr. Director.
Is there any public comment? If not, then I ask for a vote.
So moved.
Is there a
Second?
All in favor?
Aye.
So moved.
Thank you.
Item B is requesting consideration and possible action regarding the fiscal year 2021 to 2022 Human Services Commission Annual Statement of Purpose, calling on Susie Smith.
Good morning, Commission. Susie Smith, Deputy Director for Policy and Planning. So every year we are required by our charter to renew our statement of purpose, which essentially ties our programs to our state and federal regulations and law. I wanted to talk for a moment about how the statement of purpose also fits into the rebrand and our strategic planning to come. So as you all know, we recently have rebranded the agency, which has really given us an opportunity to retell our story about who we are and how we work. And so this statement of purpose fits into our new vision, which, just to remind you all, our new vision statement is a San Francisco where everyone has the opportunity and support to achieve their full potential through all stages of life. And so we do that obviously through the Department of Human Services, through administering a variety of state, federal, and local programs. And at the higher level, the goals around our self-sufficiency programs, of course, is to help our most vulnerable residents reach economic stability through programs like Medi-Cal, CalFresh, Cash Assistance, CAP, CalWorks, workforce development, and then helping people access disability benefits if they're not able to work. So the statement of purpose, goes through all of our benefit programs, as well as then the second part, of course, of the department is to prevent and protect children from abuse and neglect. I'm not going to read through all of this authorizing legislation and the purpose. However, I just wanted to highlight two pieces that are new for the commission or newly sort of enhanced. One is our food support programming, which is under, let's see, 1, 2, 3. It's the fourth piece down on the statement of purpose called Community Food Coordination. As part of COVID response, HSA, our role in emergency response is housing and food as our sort of two primary roles. And so we launched a food coordination group to provide real-time response to requests that we were getting from the community that people were hungry and needed help now. And we also use this food coordination group to look at proactively what are some of those groups who are not eligible for state and federal benefits, like Trent had just described, the effort to help undocumented folks get access to gift cards. That's an example of where we sort of proactively said, who's being left out of our social safety net during this pandemic, and how can we be proactive in identifying and supporting that population? So the food coordination group, initially it was staffed by DSWs, disaster service workers, but then we advocated with the mayor's office and the mayor that this really needs to be a longer term and longer staffed small group. So we, at least for now, we built a small team. We have a manager and a few staff who are really charged with now moving from kind of emergency response to more longer term sustained, how do we continue to help people with food insecurity? Even before the pandemic, 1 in 4 San Franciscans were at risk of food insecurity due to limited income and high cost of living here. And what we're seeing is that the pandemic is having a long-term impact on food security. I'm sure you've read or seen the lines in the mission for people that are just lining up for blocks and blocks to get access to food support, food bags. What we saw with the 2009 recession, that there's just very long tail in terms of families and individuals bouncing back. So we really see, and we're hearing reports from the food bank that their numbers and lines are not going down. There's a sustained demand. So we have a small group. We have over $40 million that the mayor has committed this fiscal year, and I think it was over $50 million last fiscal year for food support that we're administering Tommy McLean will speak after me about one of those grants that will be before you for approval. And there will be a number of additional grants in the coming months to administer food support. So that's one area that I just wanted to highlight that's listed, that's new, that we didn't have on our statement of purpose. And it simply says the Community Food Coordination Group's purpose is to facilitate the implementation of local food support programming for low-income people and families experiencing food insecurity, as well as to support a coordinated, accessible, and culturally responsive food support network. So that's one new area. And the other new area I wanted to highlight was housing support. So obviously, homelessness and supportive housing is its own department now, but there are a number of programs that are administered through the California Department of Social Services that are targeting support, homelessness prevention, and helping homeless people get housed specifically for populations served by human services agencies. So what we did here is where there were additional programming, like for example, under CAP, we mentioned the Housing and Disability Advocacy Program, which is a relatively new, the last couple of years, housing support program for disabled people experiencing homelessness. And the program called HDAP provides both SSI advocacy services to help people, disabled folks, get on SSI, largely through our internal SSI advocacy program, but then also provide housing support, so to help them get housed and on SSI. So I mentioned that. Similarly, under our Family and Children's Services, the program called Bringing Families Home, which provides housing supports, housing navigation for families who the main barrier to reunifying with their children is housing. And so I mentioned Bringing Families Home, and I think it's important to mention these programs now because the state has significantly expanded the dollars for these programs. So to the tune of doubling or even tripling the amount of money. And so we're looking at how these programs are going to expand, how they might change, and how we're doing this in partnership hand in hand with coordinated entry through the Department of Homelessness and Supportive Housing. So those are the two new areas. I also just wanted to mention that our agency strategic plan spans from 2016 to 2021. So we're in the process of reviewing and updating that plan. And, you know, for us, I think it really also is an opportunity to convey our work to the public in a more accessible way. So we're looking at creating a shorter plan, graphically designing it, highlighting some key facts and figures, and also to bring in some quotes and sort of humanize our work. So we're excited about that process. We will be presenting that plan to you all in early 2022. But I just wanted to mention that since it's obviously connected to our statement of purpose. So wanted to pause there to see if there's any questions, and then I believe we take action on approving our statement of purpose.
James McCray, thank you very much. This statement of purpose was exciting to read, really was, and I just felt good that you all are out there proactively thinking about things, looking at what's going on. I noticed in Lucky's yesterday, the shelves were a lot less lot more skimpier than the week before. So something is happening for all of us around food availability in the days ahead. So thank you for being on that. I appreciate it. Well, tell me just a little, who provides the food coordination? I mean, what does that, within our system and within the community, what does that look like? And how much are we spending there, we project?
Yeah, absolutely. So one of the pieces that's exciting, obviously we administer CalFresh, which is, you know, the major food support program. But the new part is providing grants to community organizations to help deliver food in their neighborhoods, culturally appropriate food, with linguistic support in language. So that piece is new. In addition, we have supported and have greatly expanded our support to the food bank as sort of the central hub for food support, and they have many community partners across the city. But also, I mean, what happened in the pandemic is that community organized, and they saw the needs and they shifted. Often, you know, like for example, one organization that focused on arts and running the Carnival, they shifted to completely do food. And so what we're able to do during the pandemic is respond and provide grants to community that was already self-organizing. And what we're doing now is issuing RFPs to be able to sustain that work and be able to continue to build that network. So that's one piece of it. Another piece of it is providing actual vouchers where people can go and use the vouchers at whatever grocery store they want. So similar to CalFresh, but not everyone qualifies for CalFresh. Another piece of our programming is around providing meals. So things like home delivered meals, which we obviously had through our Department of Disability and Aging Services, but we expanded that program. And meals for seniors. And in this year, we did some community convenings to understand how is our programming that we supported during the pandemic worked and what were some of the challenges. And one of the things we heard was like working families actually need meals, like they can't always get to a food bank during the hours. And so we have some programming around meal delivery and meal pickup. So it's a variety, and I can pull up just sort of the overview. It's about $42 million. And we will be, in October, we have a few different RFPs on the street now, requests for proposals now. And those grants will come to this commission in October. So you'll get much more of a detailed, look at some of that work. But I can say we have about 14 million that is what we're calling in our community food bucket.
Okay.
So yeah, just to give you a sense, and if you give me 2 other secs, I can get the rest of it if you'd like. But if there's any other questions, so we have addition, we have the what we call the isolation and quarantine food support, and that's for people who are diagnosed or have close contact, right, with someone with COVID, and they can, they have a place to quarantine at home, but they need food support. And so you can call the number and say, can you deliver me a bag of groceries? That's another piece of the response. And obviously the demand for that increases during our surge times.
Yes. Wow. Okay. Whoa. Nice.
So it's really exciting. And I think one of the pieces that excites us about it also is that it's an opportunity for DHS to partner more with the community. Because CalFresh, it's an eligibility program, and we do have some outreach contracts to help people get on CalFresh. But this deepens our relationship with the community in really partnering them around food support delivery. And I think it enables us to access and to support people who are reluctant to come into our offices, whether it's for fear of immigration concerns or for whatever reasons. It kind of broadens our net and our reach and our partnership.
Okay. Thank you. Yeah. Thank you. HSA folks, thank you. Yeah.
So yeah.
Okay. Yeah. So I do. So it's 8 million. So I've pulled it up. It's helpful for the citywide food support, which is things like the food bank. We have about 8 million. For the community partnerships, we have about 15 million. There was a program called Great Plates Delivered, which you might have heard about, which is specifically for older adults, and that's a really neat state program where we partner with restaurants to be able to deliver meals to older adults and people with, older adults actually just. That is phasing out. That was sort of funded via FEMA and state dollars. So that's phasing out, but and there was a local match required. So that part of our budget also included about 11 million for that. And then we have about 5 million for our existing aging and disability nutrition network, and about $500,000 for the isolation and quarantine helpline. So it's 42 million overall. So it's a huge amount of investment that this mayor has made into food support, which is really, really exciting.
Yes, it is. Yeah. Thank you.
You're welcome.
Thank you.
Thank you, Mr. Chair.
Thank you.
Sorry, team. I probably took way longer than Trent anticipated, but it was an opportunity to share some of the exciting work and sort of our direction.
Well, I'm sure we all appreciate that very much. Having said that, let's ask for a vote. And I have on item B, requesting consideration for the fiscal year 2021 to 2022 Human Service Commission Annual Statement of Purpose. Can I have a motion? Is there any public comment? If not, then I just ask for a motion to approve.
I move the second.
All in favor?
Aye.
Aye.
Thank you very much. Moving on to item C, Thomas McLean requesting authorization to enter into a new grant agreement with SF New Deal for the provision of Takeout Today program for a period from August 30th, 2021 to June 30th, 2022 in the amount of $500,000 plus a 10% contingency for a total amount not to exceed $550,000. Thomas, oh, there you are. Hi, good morning.
Good morning. Good morning, commissioners. Good morning, Director Rohr. My name is Tommy McLean. I'm a program analyst within the Community Food Coordination Group, which Susie just described. We are requesting authorization to enter into a new contract with SF New Deal for what we're calling the Takeout Today program. This program is the result of a request for proposals number 947, which we released while the Food Coordination Group was still within the COVID Command Center. The Takeout Today program will be a program where an individual can text a phone number, receive a code, and then they'll be able to take that code into a neighborhood restaurant and redeem it for a free same-day meal. The mission of this program is to meet in particularly urgent same-day food needs of some of our most vulnerable San Francisco residents, such as those who are unsheltered or unhoused, low-income families with small children, and those with unstable work opportunities. So really trying to focus on people who may not know where their next meal is coming from. We through this program, hope to achieve this mission by utilizing targeted, focused outreach through trusted service providers. So those who are already providing and have existing relationships providing services to unsheltered and unhoused people, and then medical providers, mental health providers, and some of those community-based organizations who Susie referenced, who these people trust and are already receiving services from, to try to co-locate this program with other services. We plan for the funding for this program to provide for 35,000 meals. The funding source for this program is primarily city and county general funds with a small portion of federal funds. Commissioners, thank you very much for your consideration, and I am happy to take and address any questions you may have about the program. Thank you.
Thank you. Are there any questions from members of the commission? If not, is there any public comment? If not, then I ask for a vote on item C.
So moved.
Is there a second? I guess I'll second it. All in favor?
Aye.
Aye.
So
Second.
moved. Thank you very much. Item D.
Thank you very much,
requesting-
sir. Thank you, commissioners.
Thank you.
All right, Mr. McLean.
Item D, calling on Vlada Gulchin. I'm sorry if I didn't pronounce that properly.
It was perfect.
Okay. Good morning. So we're requesting authorization to enter into a new grant agreement with SF New Deal for the provision of Takeout Today program for the period of August 30th. Oh, sorry, my glasses. We're on item D. Requesting authorization to enter into a new grant agreement with La Casa de las Madres for the provision of domestic violence prevention services to families involved with child welfare for the period of August 1st, 2021 through June 30th, 2024 in the amount of $1,623,000 with a 10% contingency for a total amount not to exceed $1,785,300.
Good morning,
Okay.
President Khan and fellow
Good morning.
commissioners. I'm Vlada Golchin, an administrative analyst with the Family and Children's Services Foster Care Eligibility Program. I'm here today, as you have mentioned, to seek your authorization to approve a new grant agreement with La Casa de las Madres, also known as La Casa, for the period of July 1st, 2021 to June 30th, 2024, for the provision of domestic violence services for families involved or at risk to be involved in child welfare. Domestic violence and intimate partner violence prevention services have been offered and coordinated by the Family and Children's Services for over 20 years. Due to the growth in DV/IPV prevalence and extension of assistance to offenders, services have been expanded under this grant. Since 1976, La Casa has been providing domestic violence services in the Bay Area. La Casa offers a continuum of comprehensive and empowering services to women, teens, and children exposed to and at risk of abuse. La Casa currently provides domestic violence intervention services to CalWorks families in another grant with HSA. La Casa has an existing operational agreement with HSA and has experience serving San Francisco FCS child welfare families as a component of their community-based services. La Casa will provide comprehensive survivor and offender intervention and support to families at risk for child welfare involvement. Offender services will be provided by a subcontract with Glide. Legal services will be provided by a contract with Bay Area Legal Aid. At this time, I'm happy to answer any questions you might have regarding this request. Also joining us today here is Kathy Black, an executive director, and Ankit Jain, a contract and data manager at La Casa de las Madres. Thank you for your consideration.
Thank you very much, Vlada. Is there any public comment? Seeing none,
Mr. President, I support this program, but I note that local funds predominate, and I'm just 65%, and I'm just wondering, is there any coordinated effort to have either the state and or the federal government to contribute to this type of very important service?
Maybe I could ask Robin Love to help me to answer this question.
Hello, commissioners. How are you today? Good to see you. So currently, hi, it's great to see you.
Yeah.
Great question. You usually guys don't stump me. So at this time, we are funding this program and work with general fund because of the prevalence of DV and IPV in child welfare. Part of the exciting partnership with La Casa is that they are leveraging grant funds, foundation funds, and have other sources, including individual donors, to leverage and support what we're offering. I don't have on my radar any state or federal funds at this time, but as always, we are going to continue to look out, working with our budget and fiscal folks to help us identify, Susie's team, identify opportunities where we can leverage and match with and supplement with state and federal funds.
Thanks, Robin. Hey, this is Trent. Thanks, Commissioner Yamasaki, for the question. And hi, Kathy. Nice to see you.
And nice to see you too.
So under the Federal Family First Act, which becomes operational October 1, I believe. Is that right, John? We, for the first time, will be able to draw federal 4E dollars for prevention activities that are considered evidence-based or research-based and fit into a, have to be approved by the federal government as part of a clearinghouse, and I'll walk through the thing. I know you're on the phone now, Commissioner, but short answer is we'll be seeing if this could be potentially an eligible service to draw down those federal prevention dollars. It'd still be a local match, but the federal leverage would be deeper than it is. So, but it's too early to know what will be approved by the feds, and it would have to be families who are not yet engaged in child welfare. So it would be sort of upstream DV prevention, which is something we do all the time anyway. So we could even look at the existing array of services that are provided even outside of this contract to potentially leverage federal dollars. So we'll be doing that across most of our contracts that serve at-risk families.
Yeah, and this funding does represent our continued commitment to address the DV/IPV issues within child welfare. It's one of the 4 co-occurring risk factors, I don't like to say comorbidities, for families that come to our attention. And so we're really excited to be able to offer expanded services to support this population in these services, because a lot of the families are African American or Latino, and we really want to promote reunification.
Thank you.
Well, thank you. That I like the concept that, to me, that we're developing a model on this for the state and for the nation. And we're going to be ahead of the curve. Ms. Black said, yep, and we'll be there for the big money when it flows. All right.
Thank you, Reverend McCray.
Nothing to God, dear.
So I'd like to ask for a motion of approval of item D.
So move.
So move.
All in favor?
Aye.
So moved. Thank you.
Thank you.
Thank you, Ms. Galunchin. Thank you. Yeah.
Moving on to item E, Katarina Williams requesting authorization to modify the existing grant agreement with AvantPage for the provision of translation services for a period from July 1st, 2021 through June 30th, 2022 for an additional amount of $35,000 plus a 10% contingency for a revised total amount not to exceed $121,000.
Good morning.
Good morning,
Good
Katrina.
morning, Executive Director Rohr, President Khan, and Commissioners McCray, Simmel, Singh, and Yamasaki. I'm Katrina Williams, the Acting HR Director for the agency, and I'm here to request authorizations to extend 4 language contracts for 1 year. In order to comply with state law and city ordinance regarding equal access to services, HSA has contracted with several agencies to offer bilingual services and written materials to the public and clients accessing our services. The HSA Office of Civil Rights coordinates with the department's Bilingual Services Committee and designated program contacts to identify and translate commonly used program documents and forms, and to ensure effective bilingual interpretive services are available. So the first contract, as stated, is we're asking for authorization to modify the grant with AvantPage for provision of the translation services from the period of July 1st, 2021 to June 30th, 2022, an additional amount of $35,000 plus a 10% contingency for a total not to exceed $121,000 during that time. If there are any questions about this extension, I'm happy to answer. And this is for written services.
I just have a technical question, and I have never understood the distinction between contracts and grants, and I thought it was simply that contracts were made with for-profit providers and grants were for nonprofits, but it's not that simple. And I just want to be sure that since the provider is nonprofit, that this is correctly characterized as a contract.
Commissioner Yamasaki, I see Johanna
Mhm.
Gendelman from contracts. I don't see Esperanza, but Johanna, do you want to handle that?
Yeah,
Because I get confused as well, Commissioner.
you're exactly correct. You're exactly
I'm in
correct.
good company.
Johanna Gendelman, Senior Contract Manager. You are correct. The difference between grants and contracts are that grants are with our nonprofit partners and contracts are with our for-profit partners. And there was, I believe, an error on the agenda that referred to these four as grants, and they are contracts.
Well, I beg to differ slightly with you that the error is not really on the agenda. It is on the memorandum.
Yes. That's an error.
Because our secretary is extremely alert. and
Elizabeth and I discussed this error yesterday.
Okay.
I apologize for it.
Yeah, okay.
Bringing it
So
to our
that's it.
attention, George, of course, and thank you, Johanna.
Yes, thank you.
So we're going to take each item and vote on it, but we have to vote on each item. We can't.
Yes.
Okay, so on item E, it's requesting the amount not to exceed $121,000. Do I have a motion for approval?
So move.
A second?
Second.
All in favor?
Aye.
So moved. Moving on to item F, and we're really lucky because Katerina is with us for several more votes. Katrina,
Thank
I'm
you.
sorry. I know
No.
somebody else that spells her name that way and she says Katerina. So Katrina, I'm sorry for mispronouncing it.
No problem. Thank you so much for the correction. So
Okay.
our second request is authorization to modify the contract with Trustford for the provision of translation services for the time period July 1st, 2021 to June 30th, 2022 for an additional $35,000 plus a 10% contingency for a total amount not to exceed $121,000. And this is also for written translation services.
So move.
Second.
All in favor?
Aye.
Aye. So moved. Thank you.
Thank you.
Item G. Once again, we're calling on the star of the day. Requesting authorization to modify the existing grant agreement with International Effectiveness Center for the provision of translation services for the period of July 1st, 2021 through June 30th, 2022 for an additional amount of $450,000 plus a 10% contingency for a revised total amount not to exceed $1,837,000.
Yes, and this part of the package with International Effectiveness Center is actually for oral translation services. And as previously stated, our request is to modify the contract for the provision of these, continued provision of these services from July 1st, 2021 to June 30th, 2022 in the amount of $450,000 plus a 10% contingency not to exceed $1,837,000.
Thank you very much. Is there any public comment? Then I ask for a motion to approve item G in the amount of $1,837,000.
So move.
All in favor?
Aye.
Aye.
So moved. Thank you.
Thank you.
Item H, requesting authorization to modify the existing grant agreement with Language Line for the provision of translation services for the period of July 1st, 2021 through June 30th, 2022 for an additional amount of $10,000 plus a 10% contingency for a revised total amount not to exceed $651,200.
Thank you. So as stated, this authorization for this request for authorization to modify the grant with Language Line is related to phone translation services. And it's for the period of July 1st, 2021 through June 30th, 2022. The additional amount of $10,000 plus 10% contingency, the total not to exceed $651,200. If there are any questions, I'm happy to answer.
Any questions from the members of the commission? If not, is there any public comment? If not, then I ask for a motion to approve the $651,200.
Move approval.
Is there a second?
Second.
All in favor?
Aye.
Aye. So moved.
Thank you, commissioners.
Moving on to item I. Thank you.
Thank you. Thank you.
Requesting authorization to enter into a new contract agreement with Evident Change for the provision of child welfare reporting and analytics for the period of July 1st, 2021 through June 30th, 2024 in the amount of $320,445 plus a 10% contingency for a total amount not to exceed $352,490. Calling on Casey Shute.
Ms. President,
Did I pronounce that okay or not?
Close, it's Shooty.
Judy, okay. Thank you. Thank you for being with us.
Happy to be here. Good morning, President Khan and Commissioners. I'm Casey Shooty, a Program Analyst with Family and Children's Services, and I'm here today to seek your authorization to enter into a grant agreement with Evident Change for the provision of child welfare reporting and analytics tools. Evident Change, which was formerly the National Council on Crime and Delinquency, has partnered with Family and Children's Services for over 15 years to provide support and services related to child welfare data. Under this grant agreement, Evident Change provides access and training related to safe measures and structured decision-making, both of which are proprietary tools developed and maintained by Evident Change. The first of those, Safe Measures, is an internet-based reporting and analytics tool. It takes information from the statewide child welfare database and organizes it into a user-friendly format for child welfare workers, supervisors, and managers, which allows FCS to take a more data-informed approach to its work. The second of those tools, Structured Decision-Making, or SDM, was developed by Evident Change specifically for child welfare. The SDM system brings structure and consistency to each decision point in the child welfare system through the use of assessment tools that are objective, comprehensive, and easy to use. Because SDM is proprietary to Evident Change, they're the only vendor that develops and supports the system, including the actuarial risk assessments that are its cornerstone. I'm happy to answer any questions you might have regarding this request, and I thank you for your consideration.
Thank you very much. Any members of the commission have any comments or questions?
yes, same question. This is a nonprofit, and I guess based on the previous explanation that it should be a grant rather than a contract. Is that correct?
Not a nonprofit, it's a for-profit.
Who's speaking there now?
Oh, sorry. Johanna Gendelman again speaking for contracts. Evident Change is a for-profit.
Evident Change is for-profit.
Yeah, they were formerly the National Council on Crime and Delinquency.
Okay, the memorandum indicates nonprofit.
That would be an error.
Okay, so it's a contract.
Yeah. My apologies.
Uh, So I'm asking for a motion for approval.
So move.
Second.
All in favor?
Aye.
So moved.
Aye.
Thank you. Item J. Requesting authorization to modify the existing contract agreement with MCT Technology Incorporated for the provision of a ONCE waitlist database for the period of July 1st, 2021 through June 30th, 2023 for an additional amount of $164,430 plus a 10% contingency for a revised total amount not to exceed $1,223,708. Calling on Weiming Wang.
Hi, Commissioners. This is Wayman Wong with the Office of Early Care and Education. The contract that's being recommended before you is to basically extend our contract with MCC Technology for an additional 2 years to continue to maintain and host basically an online portal that has been in use in San Francisco since 2017 that allows parents of young children ages birth to 5 to basically apply for a childcare subsidy with through our city funding, but also potentially link them up with state and federal programs that they may be eligible for. So this is one of the main ways that OECE helps identify parents that need help paying for childcare or need free or affordable childcare, and for programs that have openings and are willing to take subsidized children to identify themselves as having vacancies so that the system can sort of link the need to the supply. We're basically asking for up to 2 years of approval. OECE is going through a lot of changes right now, especially with the infusion of funding that was made possible through the court upholding Prop C recently. And so the need for this database may be substantially reduced if we're able to significantly expand and change the way we do subsidies. But while we're sort of contemplating and planning those changes, we'd like to sort of make sure that our existing systems are still sound and able to serve families while we contemplate those changes. So, happy to take any questions you may have about this online waitlist.
Are there any questions from members of the commission? Seeing none, then I ask for a motion to approve item.
I have a question,
Oh,
Commissioner.
go ahead, Rita. I'm sorry.
I just put my hand up. How long do you think the waiting list is?
Currently, there are about 2,400 families that are on the so-called wait list. Now, everybody refers to it as a wait list, but it's more of an eligibility list rather than a wait list. There's not sort of a traditional first come, first serve sort of prioritization on the wait list. When families apply to Early Learning San Francisco, they identify various needs, based on their like income or homelessness or involvement with FCS or things like that. And based on those characteristics, families are ranked, and those that have the highest need and highest priority are the first ones to receive a childcare subsidy from OECE. And so overall, there's 2,400, I think, currently, and the majority of that is families that are looking for infant and toddler care.
Thank you.
Thank you, Commissioner Semmel, and thank you. Is there any public comment? Then I ask for a motion to approve item J for a total of $1,223,708. Can I have a motion to approve?
So moved.
Is there a second? All in
Second.
favor? All in favor?
Aye.
So moved. Thank you.
Aye.
Thank you.
Thank you.
Item K, calling on Alex Shokit, requesting authorization to modify the existing contract agreement with AT&T Box for the provision of box access licenses and iCloud content management for the period of September 1st, 2019 through June 30th, 2024 for an additional amount of $3,063,851 plus a 10% contingency for a revised total amount not to exceed $3,874,559. Alex.
Good morning, President Khan, Commissioners, and Executive Director Orr. My name is Alex Shoykit, Infrastructure Manager from IT, and I'm here to request authorization for the modification to the existing contract with AT&T Box to extend the contract for 2 additional years to June 30th, 2024, and to add an additional amount of $3,063,851 plus a 10% contingency for a revised total amount not to exceed $3,874,559. The purpose of this modification is to provide additional box access licenses and cloud content management. Box is a cloud-based file storage solution, allowing our staff to more easily and securely share files with CBOs, city departments, and other partners. With Box, staff can collaborate more easily by making simultaneously changes to documents with coworkers, track those changes, and restore and share files on their own without IT help. In addition to these efficiencies, Box also helps to protect against ransomware attacks, since ransomware cannot spread within the Box cloud system. Finally, by using a cloud solution, some support burdens are lifted from IT, allowing us to focus on more impactful projects. HSA, along with DPH and HSH, have each historically used Box for the cloud storage of non-protected health information, PHI data, in which these services were previously procured through the technology marketplace. However, DPH also required cloud content management involving the maintenance, transmission, storage, and access to PHI, and this had to be facilitated through a departmental contract. An RFP was issued in 2018 for cloud content management, which AT&T was awarded. AT&T's proposal utilized the Box application as their HIPAA-compliant cloud storage vehicle. Within this contract, HSA, DPH, and HSH have combined their needs to procure Box licenses and cloud content management to ensure a more favorable cost, and HSA has taken the lead as a contracting department. OECE is also included in this contract and is currently under HSA's licenses. For this modification, we will be adding more users for each department while continuing to protect our data. We are looking to migrate all of our data from being on-premise to in the cloud. Adding these additional licenses will help us move in this direction. I'm happy to answer any questions you may have. Thank you for your consideration.
Mr. President, I have a question.
Go right ahead.
Thank you. Cloud is really a hot item today. And this, of course, is a very large amount, 75% of which is locally funded. I understand that AT&T was selected in 2018. On the expiration of the current contract, was there any search or thought of exploring other contractors, both as to cost and capability?
Yes, Commissioner Masaki. We have had a case study. We identified our existing solution to see what it will take to do on-premise upgrade. We also checked out the main competition to this product, which is Microsoft Office 365 Suite. And it was deemed based on the use cases, primarily for family and children services, that Box offers the best in terms of both pricing and features. So we have completed the study and we presented it to our management.
Thank you. I'm relieved.
Good. Thank you very much. Because when I looked on page 4 of the presentation, you see really $3 million is wrapped into the enterprise agreement for the box, and the licensing and the hosting and the environment, which is within AT&T's system, right?
Correct.
Okay.
And that covers all of our departments. So that's HSA, HSH, and DPH, as well as OECE.
Oh, okay. 4 comments. Thank you.
Move approval.
Second.
All in favor? Aye.
Aye.
So moved. Thank you very much.
Thank
Alex.
you.
Thank you.
Item 8, is there any public comment? Having seen none, then we're going to move into our closed session for a short period, and then we'll reconvene. Can I ask for a motion? Do I need a motion for that? No.
No.
Okay,
Commissioners, I need to send you a link for our private session. Does everybody have access to their email right now?
Yes.
Okay, so this may take a moment, but
so do we hang up? Do we hang up and come back in?
yeah, go ahead and leave this meeting,
Okay.
and we're going to go into the other meeting link that I will send you in a moment.
Okay, thank you.
Does that include me, Elizabeth, I assume?
Yes.
Okay.
Well, we're back in open session. Item 11 is to vote to elect to whether disclose any or all of discussions held in closed session.
That's right.
So George will ask you to
I
into the
move
proper verbiage.
that we reveal a portion of what was decided in closed session. And to wit, and list the 3 items that, a summary of the 3 items that that we approved. And again, we can clean up that language in the minutes.
I will. Voting on.
We need a second.
Second. All in favor?
Aye.
Aye. So moved. Now we're, item 12 is general public comment on any matter within the subject matter jurisdiction of the Human Services Commission.
I just want to say, as James McCray, I want to echo what fellow commissioners have said concerning Mr. Rohr's leadership. Just impressive. Always good to see him on television or standing near the light, if not in the light. And I just really appreciate how you move and carry yourself. So thank you very much.
Well, lovely. Thank you very much.
I second that.
So I've asked for public comment. Seeing none, our commission meeting is over.
Good seeing everyone.
Thank you.
Thank you, sir. Thank you.
Thanks,
And,
Fred.
Trent,
Yes.
excuse me. You probably want to go